The knuckle cracking myth claims cracking knuckles causes arthritis, a fear rooted in old warnings and urban legends. In reality, multiple large studies show no increased osteoarthritis risk, though habitual cracking can irritate soft tissues and annoy others. The sound originates from gas bubbles bursting in the synovial fluid as joints stretch, not from bone grinding. One widely cited long-term experiment followed a participant for decades, finding no arthritis connection despite daily cracking. The takeaway is clear: crack if you please, but stop if pain or swelling appears and consult a clinician.